Hello, gentlemen. Let me ask you a question that millions of men have wondered about, but very few have ever felt comfortable asking. What really happens if you ejaculate every single day? Does it make you healthier or weaker? Does it help your prostate or slowly drain your body? Will it improve your sex life or eventually make intimacy feel less satisfying? You've probably heard completely opposite opinions. Some people say daily ejaculation is one of the healthiest things a man can do. Others insist it destroys testosterone, causes exhaustion, and speeds up aging. So, who's right? The answers may surprise you, because neither side is telling the whole story. Your body doesn't follow internet myths. It follows biology, and biology is far more interesting than most people realize. I'm Dr. Claire Morgan. Today, we're going to separate myths from medical science. We'll explore what actually happens inside your brain, your hormones, your prostate, your heart, and even your future sexual performance when ejaculation becomes a daily habit. We'll also talk about the situations where doing it every day may not be the best choice, especially if you're over 50. Because here's the truth. Daily ejaculation isn't automatically healthy, and it isn't automatically harmful either. Everything depends on why you're doing it, how your body responds, and whether it's supporting your health or quietly working against it. By the end of this video, you'll know how to recognize the difference. But before we get there, we first need to clear up one of the biggest misconceptions men have carried for decades. Many people think ejaculation is simply the body getting rid of semen. In reality, it's far more complex than that. Think of it as a conversation between your brain and your body. Long before ejaculation happens, your brain is already hard at work. Nerves become active. Blood flow increases. Hormones begin changing. Your heart beats faster. Your breathing becomes deeper. Muscles throughout your body prepare for climax. Then, during orgasm, your nervous system releases a remarkable combination of chemical messengers. Dopamine, which activates the brain's reward system. Oxytocin, often called the bonding hormone. Endorphins, your body's natural pain relievers. And afterward, prolactin begins increasing, helping your body shift from excitement toward relaxation. In other words, ejaculation isn't just a physical event, it's a neurological event, a hormonal event, a cardiovascular event. Your entire body participates. That's why some men feel relaxed afterward. Others become sleepy. Others notice improved mood. It's not imagination, it's physiology. And once you understand that, the rest of today's discussion starts making much more sense. Now, here's something that often surprises my patients. The body doesn't keep score. It doesn't know whether you ejaculated yesterday or last week. It simply responds to what's happening today. If ejaculation fits naturally into a healthy lifestyle, your body usually handles it remarkably well. But if it becomes driven by stress, compulsion, or emotional escape, the conversation changes completely. We'll come back to that in a few minutes. For now, let's look at what science has discovered about the potential benefits. The first benefit isn't where most people expect. It begins inside your brain. Have you ever noticed feeling calmer after orgasm? Perhaps you've had a stressful day, your thoughts were racing, your shoulders felt tense, and afterward everything seemed just a little quieter. That's not simply psychological. When orgasm occurs, the brain releases chemicals that naturally reduce stress and promote relaxation. For many men, this creates a temporary feeling of calm. Some even describe it as hitting a reset button. Does that mean ejaculation treats anxiety? No. Serious anxiety deserves proper medical care, but it can become one small part of the body's natural stress response. And that's one reason many men report feeling emotionally lighter afterward. But the story doesn't end there, because those same hormonal changes often influence something else that millions of older men struggle with: sleep. If you've ever wondered why so many people become sleepy after orgasm, there's a biological explanation. As excitement fades, your body shifts into recovery mode. Heart rate slows, muscles relax, stress hormones decrease. Meanwhile, prolactin and other calming signals help prepare the brain for rest. For men who occasionally struggle to fall asleep, that natural relaxation may help them drift off more easily. Of course, If chronic insomnia is affecting your life, ejaculation isn't a treatment. Sleep problems deserve proper evaluation. But many men notice that when intimacy happens naturally before bedtime, their sleep often feels deeper afterward. It's another reminder that sexual health and overall health are much more connected than people realize. Now let's move to something that concerns almost every man watching this video, the prostate. Few organs create as much anxiety for men over 50. And for good reason. As we age, the prostate becomes more likely to develop problems. Enlargement becomes common. Inflammation may occur. And prostate cancer remains one of the most common cancers affecting men. So naturally, many men ask the same question: can regular ejaculation actually help? Several large observational studies have suggested that men who ejaculated more frequently over long periods appeared to have a lower risk of developing prostate cancer compared with men who ejaculated less often. Researchers still can't say with certainty exactly why. One theory is that regular ejaculation may help clear prostate fluid, reducing the buildup of inflammatory substances over time. Another possibility is that men with healthier lifestyles may simply be more sexually active. In other words, the relationship is probably more complicated than one single cause. So it's important to keep expectations realistic. Daily ejaculation is not a guarantee against prostate disease. It does not replace routine medical checkups, PSA testing when appropriate, or conversations with your healthcare provider. But the evidence is reassuring. For healthy men, regular ejaculation does not appear to harm the prostate, and it may even play a supportive role in long-term prostate health. That's encouraging news, especially for men who have spent years worrying that frequent ejaculation somehow wears out the prostate. It doesn't work that way. In fact, your prostate was designed to function throughout your adult life, and there's one more benefit that's often overlooked. It has nothing to do with the prostate or hormones or even sleep. It has to do with circulation. Because during sexual arousal, your blood vessels widen. Blood flow increases throughout the pelvic region. Your heart works harder for a short period. Your cardiovascular system becomes more active. Think of it as a gentle workout, not intense enough to replace exercise, but enough to remind your blood vessels how to respond. For many healthy men, maintaining good circulation is one important piece of preserving erectile function as they age. Of course, walking every day, keeping blood pressure under control, managing diabetes, and staying physically active remain far more important. But healthy sexual function is closely connected to healthy blood vessels. That's why changes in erections sometimes become one of the earliest signs of cardiovascular disease. The body often gives us clues long before other symptoms appear. But here's where today's conversation becomes even more important, because everything we've discussed so far represents only one side of the story. Many men hear these potential benefits and immediately conclude, great, more must be better. Not necessarily, because when daily ejaculation becomes compulsive or starts replacing emotional connection or begins affecting your sensitivity, the picture changes completely. And those are exactly the situations we'll look at next. But here's the part that rarely gets discussed. The same habit that benefits one man can quietly create problems for another. The difference isn't always how often ejaculation happens. It's why it happens. Let me explain. Imagine a man who enjoys healthy intimacy, stays active, sleeps well, and occasionally ejaculates every day simply because that's what feels natural for him. Now imagine another man who feels lonely, stressed, or anxious, and uses masturbation as his only way of escaping difficult emotions. From the outside, both men may be ejaculating daily. Inside, their situations are completely different. The body doesn't only respond to the physical act, it also responds to the emotional pattern behind it. That's why one of the first questions I encourage men to ask themselves is this: am I choosing this, or do I feel like I have to? If it feels completely under your control, that's one thing. If it begins interfering with work, relationships, sleep, or daily responsibilities, that's another. Compulsive sexual behavior deserves the same attention as any other habit that starts controlling your life instead of serving it. The next point surprises many older men. Daily ejaculation itself doesn't usually reduce testosterone in any meaningful long-term way. This is one of the oldest myths on the internet. Yes, hormones naturally fluctuate throughout the day, but current research has not shown that regular ejaculation permanently lowers testosterone in healthy men. Your hormone levels are influenced much more by things like sleep, body weight, exercise, chronic illness, certain medications, and age. Many men spend years worrying about ejaculation while completely ignoring the fact they're sleeping 5 hours a night, never exercising, and carrying uncontrolled diabetes. Those factors have a far greater effect on sexual health. Now, let's talk about something else that deserves attention: sensitivity. Some men notice that when masturbation becomes extremely frequent, especially if it's always done in exactly the same way, their bodies become accustomed to a very specific type of stimulation. Then, during intimacy with a partner, things may feel different. Not because their partner is doing anything wrong, but because their brain has learned to expect one familiar pattern. That doesn't mean masturbation damaged their body. It simply means the nervous system adapted to repeated stimulation. Fortunately, the nervous system also adapts in the other direction, changing habits, slowing down, allowing more variety, and focusing on connection rather than speed often helps restore normal responsiveness over time. The body is remarkably adaptable. Another issue worth discussing is physical discomfort. Healthy ejaculation should not regularly cause significant pain. If you begin noticing persistent soreness, burning, blood in the semen, or pelvic pain afterward, don't simply assume it's because you're ejaculating too often. Those symptoms deserve proper medical evaluation. Sometimes the cause is completely unrelated. Inflammation, infection, or prostate conditions can all produce similar symptoms. Your body is giving you information. Listen to it. There's another situation where daily ejaculation may not always fit your goals. If you and your partner are actively trying to conceive, timing sometimes matters. Frequent ejaculation doesn't usually eliminate fertility in healthy men, but depending on the individual situation, your fertility specialist may recommend adjusting timing to maximize sperm quality when conception is the priority. That's a conversation best guided by your own medical team rather than internet advice. And finally, there's one point I never want men to overlook. Intimacy is much bigger than ejaculation. Far too many people judge their sexual health by one single event. Did I ejaculate? How long did it take? Was it intense enough? But lasting intimacy isn't built on one moment. It's built on trust, communication, affection, laughter, touch, emotional safety. Those things often determine satisfaction far more than numbers ever could. I've cared for couples in their 70s who described their intimate lives as deeply fulfilling, not because everything worked exactly as it did at 30, but because they learned to adapt together. They stopped chasing perfection. They started enjoying connection. That shift changed everything. So, what really happens if you ejaculate every day? For most healthy men, the answer is surprisingly ordinary. Your body is fully capable of handling regular ejaculation. It doesn't automatically weaken you. It doesn't drain your masculinity. It doesn't permanently reduce testosterone. And for many men, it may support relaxation, sleep, and even long-term prostate health as part of an overall healthy lifestyle. But frequency alone never tells the whole story. Ask yourself a better question. Do I still feel energetic? Do I enjoy intimacy? Is this habit under my control? Is it supporting my relationships or replacing them? Those answers matter far more than counting days on a calendar. Gentlemen, I'd like to hear from you. How old are you and what country are you watching from today? Leave your answer in the comments below. I always enjoy seeing men from all over the world learning together and supporting one another. If today's discussion helped clear up some of the myths surrounding men's sexual health, please consider pressing the like button. It helps this information reach other men who may have the very same questions but have never felt comfortable asking them. And if you enjoy practical, evidence-based discussions designed specifically for men over 50, be sure to subscribe. I'm Dr. Claire Morgan. Thank you for spending these minutes with me. Until next time, take good care of yourself, because your health is one investment that always pays you back.